This is an example of preoperative cardiac assessment. For preoperative cardiac assessment, the first thing I need to know is it emergency surgery or not. I'll choose non-emergent. I need to know what conditions the patient has, what medications is the patient on, and does the patient have a history of stable ischemic heart disease or ACS within the last year? Let me say no. I then get to estimate my risk of MACE, so I'll use my RCRI calculator. Let's say it's a high-risk procedure. I'll just choose my different conditions, submit, which is an elevated risk. I get to calculate my metabolic equivalence, or I can even use a DOSI scoring. So I'll use my DOSI scoring to calculate my metabolic equivalence score. And as I choose what's relevant to my particular patient, it ends up with the equivalent of a METS 4 to 10 score where I tap to read. I get back my inputs on the top, what I chose. I get back my specific recommendations for overall risk, additional tests, medications, and comorbidities. I can bring specific examples within medications that correlate directly to my patient. And because my patient is on a beta blocker, for example, I get that I should continue my beta blocker and more details. I have about antiplatelet agents, statins, basically everything specific to the medications that my patient's on. Same thing for comorbidities. I can get more details, like for what class 1 actually means by the AHA recommendations, and also link out to individual references to be able to get even more detail into what it is that I'm reading. I'll hit X and hop right back in. This is one example of avoMD's pathways.